Hello, and welcome to today's session, Uncovering America's Best Kept Secret, Family Resource Centers and Family Resource Center Networks. That's provided by the National Family Support Network. My name is Andrew Russo. I'm the co-founder and director of the National Family Support Network, and will be presenting today along with Brenda McChesney, our newly hired associate director, who is also a co-founder of the National Family Support Network. We're glad to see you all here today. As we get started, we want to get a sense of who is here in the virtual room. So we're going to be launching a couple poll questions here. The first one is about where you're joining us from. So looking at this map on your screen, if you could identify which region of the country you're in according to this map, or if you're coming from outside of the country, there's also an option for that in the poll. So the poll that's launched in the middle of your screen here, if you could take a moment to click on that and let us know where you're joining us from, we'd appreciate it. All right, last seconds to vote in the poll there. Okay, so we see that we have folks joining us from all across the country today. So wonderful, with the majority being from the West. And we also have someone who's joining us internationally. So feel free to share what country you're joining us from, that we can especially welcome you. So now that we know we've got folks from across the country, our next question for you is about your affiliation. So you'll see a list of options in the poll in the center of your screen again, whether you work at a family resource center or you're a parent leader or you work in education or child welfare. Please take a moment to fill out the poll here and let us know your affiliation. And if you select other, you're welcome to share in the chat what other represents. All right, last seconds to vote in the poll here. Okay, so once again, we have a great variety with people joining us from family resource centers, family resource center networks, other family support programs. We have several parent leaders here. Special welcome to you. Early care and education providers, folks in education and child welfare and other government departments. We have a private funder here and also other. So wow, lots of rich diversity here, both geographic and in terms of affiliations, the hats you're wearing. Glad to see that. And today's webinar will be recorded, and the PowerPoint and the materials that we share will be available on the NFSN website by this time tomorrow. So just FYI that you'll be able to access all the materials and info that we're sharing via our website in the Webinar Wednesday section tomorrow. Okay, so we'll turn things over to Brenda now, who's going to walk you through our time together.
Hello, everyone. So today we will be going over family resource centers, family resource center networks, the National Family Support Network, the NFSN resources and opportunities, and then have a chance for some Q&A at the end to answer your questions. So let's hop right in with an overview of family resource centers. So the concept of family resource centers actually dates back to the late 1800s with the creation of settlement houses in major metropolitan areas such as New York, Boston, Chicago, and San Francisco. Settlement houses provided large number of immigrants entering the country at that time with support, job training, English classes, social advocacy as a means to assist them in understanding, adapting to, and succeeding in American society. This slide that you see in front of you illustrates the Good Samaritan Settlement House in San Francisco. On the left is actually from 1913, and on the right is its modern look as the Good Samaritan Family Resource Center that continues to serve families today. What's really interesting is that originally it served immigrants from Europe, and the Good Samaritan has evolved over time with changing community needs and shifts in the neighborhood population into the Family Resource Center serving the Latino community today. Thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar, as we like to say, America's best kept secret. A family resource center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of the Family Resource Center in Vermont, or they may be school-based, like you can see on the image on the right from a Family Resource Center in Kentucky. So family resource centers also may be in rural settings, like the image you see on the left, the one from my home state right now in Colorado, or in more urban settings, like the image on the right of a family resource center in the Bronx in New York City. Wherever they may be based, family resource centers work with families with an approach that is not only two generational, but multi-generational, strengths-based, and family-centered. Each of these three concepts is really important to highlight. Multi-generational, you may have heard of 2Gen or 2Gen work. Well, family support is the original, not just 2Gen work, but multi-generational work, as our programs work with families that include children, parents, and grandparents as well. It's also strength-based because we see families as having strengths that we want to support them to build upon, and family-centered because, of course, everything we do has families at the center of it. Family resource centers are designed for all families, not only low-income or high-challenged ones. They also provide so that the support that they provide is non-stigmatizing, making it more readily accessible. Programming is provided at no cost or low cost for participants. You'll see that the image on the right is of a family success center in New Jersey. There's actually 57 family success centers across the entire state of all 21 counties that they have. And each county has at least one, with typically more than one family success center. That includes high affluent counties as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for two of the most important roles that we can have as adults, being parents and being spouses and partners. These two most important roles that we could have, for which we could typically receive no support or training for, hence why the value of family resource centers and universal access for all is so important. So now we'll take a second to talk a little bit about the strengthening families' protective factors, which include parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and social emotional competence of children. So we are curious, for those who are participating, how familiar are you with the strengthening families' protective factors? Not familiar, somewhat familiar, familiar, or very familiar? Go ahead and take a second to vote. All right, so we have the majority at 42% being familiar with between somewhat and very familiar. So most folks have heard of them, which is really great. For those of you who this might be a little new, a few highlights that are really important to know is that they come from the Center for the Study of Social Policy. And research has shown that these 5 protective factors shown above increase family stability, enhance child development, and reduce child abuse and neglect. So as we're working with families, we want to support them to build these protective factors because we know that they make a positive difference in families that we serve. Family resource centers, there is no dedicated federal funding for family resource centers. And this is unlike Head Start or home visiting or after school programs. Yet there are now more than 3,000 of them working with more than 2 million people annually. So the question we often ask ourselves is, why are so many public and private funders at the state, county, city, and community level choosing to invest in family resource centers? Simply put, family resource centers are just a good idea. They're cost effective, highly adaptable for various communities, be they urban, rural, or ethnic, and have demonstrated successful outcomes through multiple external evaluations. As conveniently located hubs, they bundle and co-locate many services that may be familiar to you, such as home visiting, evidence-based parenting programs, or parenting education, health screenings, play groups, fatherhood programs, family counseling programs, food banks. You can see here the rich diversity of services that family resource centers often offer. And family resource centers are shaped by and responsive to their community needs. We often say if you've seen one FRC, you've seen one FRC. And because they're so responsive to their community, we find that families are engaged in shaping the programs and the services to be responsive to their interests and needs. Family resource centers hire staff who represent and share the lived experiences of the diversity of the families that they serve. And because we're such big proponents of parent engagement and parent leadership, parent advisory committees actually impact program development and implementation so that they always are meeting the family's needs of where they're at. At the same time, despite their organic development, there's remarkable similarity in the most common service areas, as you'll see above, and we'll go through in a little bit more detail. This data actually comes from the national study funded by the Robert Wood Johnson Foundation that the NFSN worked with a research institute to conduct. So you'll see the most common service areas, the first one is around parenting support. It exists on a continuum from a lighter touch to more intensive touch. As you'll see, the lighter touches are really exemplified by parenting workshops or parenting support groups, whereas you get to heavier touches, you're looking at education series for parents using evidence-based curriculum or home visiting programs, which are highly intensive. Similar are access to resources, and this is a core foundational aspect of family resource centers, again, going from a lighter touch to more intensive touch. On the lighter touch side, enhanced information and referrals, concrete supports, and on the heavier touch side, working with families over time to address family identified goals or co-location of services. You'll also see very common with family resources are child development activities, as well as parent leadership development. And FRCs are not only provide programs, but they also build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. This is a parent testimonial coming from upstate New York in Corning, New York by Sheila Harewood that we would love to play for you for a second.
Parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax. And it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life, regardless of anyone's socioeconomic status, regardless of racial background, educational level. The need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
What I love about Sheila's story is it really captures the heart and the essence of what family resource centers can provide for parents within any given community. And as we know, that journey from being a human transforming into a parent is one of the most monumental shifts we'll ever go through in life. And family resource centers are the heart of what helps families succeed in that space. So now that I've described a little bit about family resource centers, I'm going to launch another poll. And this poll is going to ask if you've seen programs that look like family resource centers in your state. Yes, no, or not sure. That's really good news to hear. Close to 80% saying, yes, absolutely. We have programs that look like family resource centers in my state. That's fantastic. Now we'll dive in a little bit about family resource centers and a response to COVID and innovations happening in the field with Andrew.
All right, thank you, Brenda. So telling the story about FRCs is interesting to note something that changed in relation to the pandemic. So during the pandemic, we saw a situation where suddenly all families had needs, all families faced challenges. Everyone was struggling to find formula or diapers or food to feed your family. And so in that kind of environment where there were great challenges that were all families were facing, what we saw was that family resource centers stepped up to answer that call. And so family resource centers rolled up their sleeves and redoubled, retripled, quadrupled their work, did whatever was needed, keeping their doors open when sometimes everything else was closed to ensure families had access to supports. So these images capture some of that amazing response, such as at the top in Kentucky. And when the schools were all closed, in Kentucky, the FRCs are school-based, the schools were all closed, the FRCs took on the role of ensuring that families still had access to the free lunches that kids would get at school, taking on delivering them to the families at their homes. The image on the right is Colorado, distribution of infant formula. We see the programs turning to virtual services to break isolation and help families connect with each other and with story time during the pandemic, toy distribution to families that other programs did. Lots of wonderful ways that the program stepped up. And what was different and what changed with family resource centers is this stepping up was actually noticed. And for the first time ever, we saw a state, Alabama, in this case in May of 2020, that recognized what FRCs were doing. They had long had FRCs and funded FRCs, but they said, wow, their response to the pandemic is really something amazing, that we should invest further in these programs. So Alabama was the first state to do that, to increase funding for FRCs in May of 2020, and then was rapidly followed by states red and blue across the country, with California and Vermont and so many other states contributing resources into FRCs, recognizing they're valuable to have around, not just during times of crisis, but always. This next slide shows you the level of investment that has happened just in the last year or so. So that investment, the further development of FRCs, FRC networks, has continued unabated from May 2020. And so these states that are listed here, you see investments in developing infrastructure for FRC networks. You see states that already have FRCs making further commitments and developing new FRCs. And we see new networks established, such as in Minnesota, Nebraska, and Wyoming. And we see states that making investments in FRCs for the very first time, such as in Kansas, Michigan, South Carolina, Virginia, and Washington. So we've gone from being under the radar to suddenly all the rage, with so much attention to FRCs, unprecedented levels of funding and resources now coming into this field, which is so exciting and This slide was developed in partnership with Casey Family Programs, which is one of the National Family Support Network's national partners. And what this illustrates is the continuum of how FRCs might work with families across child welfare involvement. So it starts with primary prevention, which is what FRCs are most known for, is supporting families to be healthy and strong, building those 5 protective factors that Brenda reviewed with you earlier, that then will be more likely to ensure that families are healthy and strong and never enter the child welfare system at all. The next column is differential response. So that's when a call comes in to the child welfare line and they decide that it doesn't rise to the level where they're going to open a case, but they could tell the family could still use some supports. So then they refer them over to the FRC. And we'll talk more about what we've learned about when states do this, states or jurisdictions do this. Next is when there's an open child welfare case. And so there's an open child welfare case, and let's say the family is told that they need to take parenting classes. Well, where do we send the families for the parenting classes? You send them to the FRC, which is already providing parenting classes, already using evidence-based curricula, and has the great benefit of being a place that, as Brenda referenced earlier, is not stigmatized. So in that parenting education class, you're in that class along with parents who are there voluntarily, as well as those who may be mandated to be there. And unless they self-disclose why they're there, nobody knows the difference. So there's less stigma around accessing that kind of support. And the families can also be connected with other resources and opportunities that the center provides beyond the parenting classes. And then finally, the last column, post-reunification, when the child and family are reunited, then there may still be issues or resources that are needed to support that family's healthy development. And who's there to provide it? The FRCs. The FRCs continue to provide wraparound support to families as long as they may seek it. So Brenda mentioned earlier the research that's been conducted on FRCs, and we're going to share some data with you here that are examples of how FRCs have been shown to be incredibly valuable through multiple external studies. This first piece comes from Alabama. So Alabama commissioned a social return on investment study that showed for every dollar invested that the state received $4.93 in immediate and long-term benefits. So basically a 1-to-5 ratio. In Allegheny County, Pennsylvania, where Pittsburgh is located, they have 28 family support centers. That's what they call FRCs there. And they worked with the University of Chicago, Chapin Hall, to conduct research about them and found that where the centers were located, they had a 26% lower rate of child abuse and neglect investigations, which just makes sense because if we invest in supporting families to be healthy and strong upfront, the less likely they are to show up in the child welfare system later. This is my favorite piece to share with you, which comes from Teller County, Colorado, a semi-rural county outside of Colorado Springs. Their human services agency, which is also a child welfare agency, moved to a differential response system in 2006. So when the call came into the hotline and they decided they weren't going to open a case, they referred the family on a voluntary basis to the FRC. So just if the family wanted, here's a FRC that you might want to check out. Since they moved to that system of referring the families over to the FRC, they've had a 63% reduction in the child abuse rate. A 63% reduction just by referring families on a voluntary basis if they want to go to the FRC. And they only have one FRC in the whole county. This data says so much because think of the incredible savings, not only the cost savings, because of course, family resource centers are providing supports that are far lower in cost than downstream child welfare services later, but the human costs, like how many families will access supports and resources that then will not lead to them being in the child welfare system at all, the human cost savings. And when we unpack this, this data is not magic. This makes all the sense in the world if you understand FRCs, because 60% of the calls to child welfare are for perceived neglect. So neglect, typically parents seen as withholding resources from their children. But in general, it's not that parents have resources they don't want to give their children. They don't have those resources to begin with. So along comes a program called a Family Resource Center, where the whole point is providing resources where the families can then get access to food or clothing or temporary assistance with rental payments and such, where then they're going to get those supports. They're not going to be reported as neglecting their children. They're not going to end up in the system. The other part of this is what Brenda referenced earlier, is because FRCs do so much to break isolation and connect families with each other to build that all-important protective factor of social connections. Child abuse is highly correlated with social isolation. So when families connect with each other through the community of parents and caregivers that FRC fosters, the less likely we are to see them end up in the system. So we were fortunate with the support of Casey Family Programs to take that data point further and to investigate what are the actual cost savings to child welfare when that happened with that FRC in Teller County, Colorado. So you see here on the screen, for every dollar invested, that it saved the county $2.92, totaling more than $2.5 million saved in the system. And then we matched that with looking at an urban area in Orange County, California, and found even greater savings for every dollar invested. In Colorado, the network there demonstrated that the FRCs working with families had seen statistically significant improvements across multiple domains, including families' economic self-sufficiency, health, access to concrete support, social support, family functioning, and resilience as well. And this piece comes from Kentucky. So Kentucky, more than 30 years ago now, had a situation where they were doing really poorly in terms of educational outcomes. And there was actually a lawsuit. And then the state legislature took up education reform and passed a series of measures around improving the educational system. And somebody at the table had the bright idea of trying to make sure that families would be part of the picture, recognizing that when families are engaged, kids in schools do better. We know that from lots of research. So they created a formula, which was every school that had 20% free or reduced lunch or more could have an FRC if they wanted one. Now, 20% free or reduced lunch, that's not very high. So basically, any school that wanted an FRC could qualify to have one if they wanted, but they had no idea how many principals, how many school districts would actually be interested. They put the formula out there, and it turned out everybody was interested. And so Kentucky has 888 family resource centers. 888 school-based family resource centers, and they've been doing it for more than 30 years. And they've done that all with state funding, by the way. So when we talk to states trying to figure out how can we fund FRCs, we point out if Kentucky can fund 888 centers and has been doing it for more than 30 years, you can figure out how to fund a few dozen. And during that time, Kentucky has moved from 45th place to among the top 15 school systems in the country. There are a lot of factors that have contributed to that, but definitely we know when families are engaged, children in schools do better. And FRCs that are school-based are not only focused on supporting the families of children in the schools, but they also are supporting the families to be school ready. So they'd be doing work to engage families and coming to the schools and doing home visiting and other activities to help ensure that children and families will be school ready, which definitely makes a difference in terms of educational outcomes overall. So what does it cost to run an FRC? Well, it varies in relation to the particular cost of living, the kinds of programming that they're providing, and what space they have. So we like to share these two data points, one which comes from community-based FRCs in New Jersey, and another that comes from Kentucky, from school-based FRCs, where the costs are much lower because they have the space provided in kind. Either way, you can see these are not big budget items. Family resource centers are not huge expenses, and yet they produce incredible results. So these are investments that we've seen so many cities, states, counties, public and private funders be really excited to make, as Brenda was sharing earlier, because that's how FRCs are funded. As we mentioned before, there's no dedicated federal funding. However, so most of the funding that would come into supporting FRCs comes from state, county, or municipal governments. So that's the biggest funder overall of FRCs would be government funding, but not federal funding. There are federal dollars that are leveraged creatively by states to support FRCs. The most common is the flexible funding that's in the community-based child abuse prevention program, or CAPTA, and CBCAP is that particular source, and states can pretty much use it for anything they want in relation to child abuse prevention. It has traditionally, however, been a very small sum of money, so actually barely $40 million for all 50 states. So that's not even $1 million per state. And states had to figure out, well, how do we use these small sums of money to make a difference with child abuse prevention? Many of them chose to use them for FRCs, since, as mentioned, they're not a big ticket item and they can go a long way. We'd also see foundations, corporations, individual donors, and in-kind support being critical to FRC's funding. This next slide talks about FRCs in relation to Family First. Family First was landmark child welfare reform legislation that passed at the federal level a little over 5 years ago. And one of the things that Family First allows for is for families to be with their children, although they're reported to child welfare, but when they're still intact, the child is still with the family, that services and supports can be provided to try to help that family to get on track and to not be separated. So one of the pieces is that the funding can support in-home parenting support, which does not mean home visiting per se. It means services that are provided while the child is in home with the family. So all this by way of saying is these federal funds can actually be leveraged to support things that FRCs are already doing, such as parenting education classes using evidence-based curricula, motivational interviewing, and other programs like that. So this funding is now available, but we actually have yet to see states being able to pull it down for this purpose. So it's something we're hoping will move forward. Family First also had a strong emphasis on ensuring that kinship and grandfamilies were supported, as so many grandparents and kin are caring for children in our nation. And so FRCs can also be leveraged to support these kinship and grandfamilies as they naturally are positioned to provide resources to families. And that's exactly what kinship and grandfamilies are typically looking for. And we've been very excited to see that the New Hampshire network was the first state to intentionally leverage its network of FRCs to support kinship and grandfamilies. So now that we've talked about FRCs, we'll just go one level up further to talk about networks of FRCs. So not only have different states and counties and cities hit upon the value of investing in FRCs, but they also hit upon the value of networking them together. So recognizing that's when you can really make a difference, is when you bring the centers together, that then you can leverage their peer sharing, their mutual support, the coordination of services to ensure that families are well supported across a whole system. So the network serves as a backbone to leverage that collective impact of the centers. And it may be an independent nonprofit that is playing that role of bringing the centers together. It may be coordinated by a public or private funder, or it may be led by FRCs that are coming together on their own. The most common functions of these networks are listed here, also from the research that Brenda cited earlier. The FRC networks have also emerged organically. So just like if you've seen one FRC, you've seen one FRC. If you've seen one FRC network, you've seen one FRC network. And at the same time, we know based on the research that there is also commonality across their main functions, which include increasing coordination, connectedness, cooperation, and collaboration amongst their members, providing training and technical assistance, working on advocacy, policy, and legislation. So they can do so much more to move the needle collectively on issues that affect families than an individual center could do working on their own. And then also providing and maintaining a shared data tracking system is something common in a number of networks. This slide references the type of networks that I referenced earlier that are coordinated in different ways, such as by center directors coming together out of the goodness of their heart and starting a network where they serve in voluntary leadership without any staff to do the work of the network. They may be coordinated by a public or private funder that is not only funding the centers, but is taking on those network roles that we showed on the earlier slide. They may be coordinated by a nonprofit, such as we've seen a number of Prevent Child Abuse America chapters, for example, in different states, take on the role of coordinating a network of FRCs, or they may be an independent network. So that's when they are a 501c3, a nonprofit themselves, and function as a membership association where the members pay dues and the network provides various kinds of support. And they may be intermediary, where they raise funds and distribute them to their members, or they may be non-intermediary, where they don't do that. So as you can see, there's a lot of variation and diversity about the types of networks that are out there. And the last slide I'll share before turning things over to Brenda is another way we categorize these networks is in terms of their stages of development. So we talk about emerging networks that are just getting started in roughly 0 to 3 years and deciding on what they're going to focus on, what their structure is going to be, how the leadership will be composed. Next, we see networks that are evolving. So in this middle stage, 3 to 5 years, where by this point, typically they might have some funding, have hired some staff or a contractor to work with them. They have more track record of things they've been able to accomplish together. And then established networks. So established networks have been around 5 or more years. And by this time, they typically have staffing, they have more resources, a longer track record of things they've done together. Another interesting characteristic is that they've weathered challenges together. So they've actually gone through ups and downs and decided to stick it out and stay together at the end of the day. So this is another way that we categorize networks in terms of their stages of development.
There we go. Thanks so much for going over that information, Andrew. And I am really excited to get to talk about the National Family Support Network, which starts as at the inception point in 2011. Actually was with the Colorado Family Resource Center Association. So as Andrew was referring to, a collective of family resource centers at a statewide level. And we received a phone call from Andrew Russo saying, I'm seeing if there's interest in state networks coming together. And in 2011, Colorado hosted the very first meeting of 8 states who came together. About 15 people came to the table, and you can see the states that were represented at that time to form the National Family Support Network. For the first 4 years of our existence, the NFSN had no paid staff, so we fell into that volunteer network. And we had steering committee members running it. Andrew and I co-chaired it for 6 years together. And we did all the coordination work of the National Family Support Network as volunteers on top of our daytime jobs running the statewide networks. You'll see that that's very common within the Family Resource Center Network, and state network system. So over the last decade, the National Family Support Network has actually quadrupled in size to where we have now 40 members, 39 states and DC that represent more than 3,000 family resource centers that serve more than 2 million people annually. I love that now that we look at this map, it's a sea of green with not many states left to bring on board. You know anybody in that white state, give them the nudge to give us a call. Our newest members to highlight are Nebraska, and they joined in April, and then Wyoming, and they joined in September. So the mission of the National Family Support Network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. Our vision is about turning the whole map green, as I was just mentioning, so that all families have access to quality family support services in their communities, provided by quality family resource centers, supported by strong quality networks. So the areas of work of the NFSN are 3 core buckets. The first is connecting and convening member networks to enhance their effectiveness. This is one of the big assets and values of being a part of our national network, is really getting that peer-to-peer support and member connectedness. We increase connectedness amongst members for peer learning and mutual support. It's one of the highest rated aspects of being a member with us. Second is promoting family support best practices and evaluation. As you know, like, we need to raise the awareness of what quality family support looks like. And we do this by promoting a common language, standards, and evaluation of it through the national implementation of our standards of quality for family strengthening and support. And thirdly, we raise the visibility of the value and impact of family resource centers and family resource center networks in order to strengthen and increase support for families in local communities and across the country. So let's talk a little bit about what does membership look like. So we only have a few criteria when it comes to joining the National Family Support Network as a member. The first is that we define a member as 2 or more family resource centers coming together, and they may be at any stage of development that Andrew referred to of a network. It may be very new and emerging or established, and also that it's 1 network per state. So we help galvanize that at a statewide level if that support is needed. And then when it comes to dues, because that's often a question of how much does it cost, we try to make it really reasonable, especially if you're a newer member. So for a whole state, regardless of the number of FRCs, like having 888 or just a handful, new member dues are $700 for volunteer coordinated networks and $1,000 for all other networks. That's year 1. And then ongoing, the membership dues are $900 for volunteer networks and $1,200 for all other networks. So a really easy and doable entry point for all the assets and resources that we provide to our members. And with regard to the standards of quality for family strengthening and support, as we referenced, is one of our core pillars of the work that we do. We designed it so that it could be used by all stakeholders, be it public departments, foundations, community-based organizations, and even families, as a planning tool for providing and assessing quality practice. What we found is our members find this to be a really great way to create that common language, to be able to look at their programs within their communities, look at their systems of support, and be able to talk in the same language about what does quality practice look like, and then making plans to improve that practice over time. And they uniquely integrate and operationalize the principles of family support practice with the strengthening families approach that is research-based that we talked about above, that integrates in the evidence-based 5 protective factors. The standards of quality create that common language, as I was just mentioning, and expectations across a variety of different types of family strengthening and support programs, such as family resource centers or home visitation programs or child development programs. As we mentioned in the slides before, family resource centers have a real diversity of programs that they offer, and they really help to speak to the threads across all of them. They also help to ensure that families are supported and strengthened, and are available along with the implementation tools for free on the National Family Support website. So we definitely invite you to come on to our website. You'll be able to find all the tools and the resources there with the quality standards and the reflection tools that help to provide a context of what quality family support looks like at a program level, organizational level, and individual staff reflection level, as well as a parent participant survey. And the standards of quality were revised actually in March of 2021 to really reflect an enhanced focus on diversity, equity, and inclusion, as well as reflect our growing partnership within Canada and the US contexts. So very diverse and inclusive, and they focus on 5 core areas of practice. So family-centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And what I can say is that having been a master trainer for the standards and implementing this both in Colorado and helping do training across the country, I can't tell you the number of staff that came to the training and when they left, feeling a renewed double down space for their passion and their mission in family support, including one person who had been in the field over 20 years. And she came up in tears afterwards saying she had lost all the gumption that she had for this work that got her into it in the first place. And this is the first time that she had that renewed focus and energy after doing the standards training. So not only is it evaluative and impactful on a programmatic level, but that really that personal individual impact can't be understated. And what I love is like how far we've come with the quality standards. So you'll see in this map from May of 2012 till May of 2023, this is a reflection of the standards across the country. So we have hosted over 580 trainings. We have over 15,000 people certified and over 130 trainers of the quality standards. And in case you're wondering how, what do people think about the training? What are their reviews on the training? We get outstanding scores of satisfaction. We have 4.78 out of 5 on overall satisfaction, and people come out really ready to implement the standards at the program and organizational level in their lives. So here's a little bit about the blueprint for the development of strong networks of family resource centers. The NFSN worked with its members to develop this blueprint for how to scale family resource centers and FRC networks to ensure that all families have access to quality family support and strengthening services. And the NFSN publicly reports back on progress annually with a briefing event in May. So this is a really great opportunity for our stakeholders to understand what's being done, what movements being made, how people are implementing it, how they're evaluating it, how they're supporting it at the network level, and all through a national context and lens. And with regard to our national partners, you'll see here we have the major key players across the country who are interacting and promoting families as a part of our national coalition. And since the beginning, when the idea of starting the NFSN first emerged, the co-founders reached out to these organizations and entities that offered their support. So in here, you'll see that we have the U.S. Administration for Children, Youth, and Families, Casey Family Programs, the Center for the Study of Social Policy, which developed the Strengthening Families Protective Factors, the Children's Trust Fund Alliance, Families Canada, Friends National Resource Center for Community-Based Child Abuse Prevention, and Prevent Child Abuse America. And we work collaboratively with them and as well as many other organizations to really uplift quality practice for families across the country. We partner regularly and they participate in NFSN activities, including serving on each other's committees, co-sponsoring events, presenting at events, and working collaboratively on joint projects together. So now we'd like to hear from you. This is one of our buzz sessions. So we'd love to have you chat in what resonates most with you from the information that we've shared. So I will start to read off some of the chats that are coming in, but we want to know what resonates most. And then what would you be interested to explore more? Successful FRCs have successful networks. Lindsay, well said. That is absolutely right. But the most successful of them have a backbone support organization that helps with really uplifting quality practice, evaluation, funding, advocacy, legislation. The list goes on of what those backbone networks do for family resource centers. I heard Cassandra say that the impacts that have been made and have been quantified. That is right. It's pretty exciting. We have a question coming in that we will put toward the end Q&A that Andrew will field from Rudy about have there been any actions to support federal funding. For now, we'll highlight any other things that resonate or what you'd be interested in exploring more of. We have Lacey saying interested in learning more about startups as we're in the midst of opening up a center. Woohoo! That is awesome news, Lacey. Congratulations. We are definitely very skilled in helping you navigate toward that space of starting a brand new family resource center. Would be happy to connect with you following this call. All right, lots of thank yous. Also from Aaron, that kinship navigator support is very intriguing to me, considering my community's makeup. Yes, you are not alone in that, Aaron. We have resources available on that. We can speak to more at the end. And another question that we can field at the end of what have communities done to get cities and counties to support funding an FRC? I'll make note of these questions. I'll turn it over to Andrew to continue moving us through the rest of the presentation, and then we will dive into some of the Q&A at the end. Thanks so much.
Thank you, Brenda. So again, as you have questions, you will see in the navigation bar, there's a Q&A with two little bubbles on that. And if you click on that with the two little bubbles, that's where you can add your questions. So add your questions there and add your comments in the chat. So it just divided up a little bit there. Okay, so we will take your questions at the end after we go through resources available through the NFSN that may be of use to you to explore further. First, we want to point out is the FRC page of the NFSN website. So this FRC page is a compilation of all things FRCs. So here's where you can find overviews that explain the history, the background, the context of FRCs. There are videos like the video you saw today from Sheila. There are other parent videos there. There are virtual tours of FRCs that you can visit across the country. All the research reports that go with the data we shared today are compiled all in one place on the FRC page as well, and also information about systems level funding of FRC. So lots of information on the FRC page of the NFSN website. Another resource that's on the website are member network snapshots. So let's say you're in Alabama and you'd like to know what the Alabama network is up to. You can navigate to our members section, and that's where you'll see the map that Brenda was sharing earlier. But that map is actually interactive. So you click on the map on your state, if it's green, and it will pop up a document that looks like this, two-sided, that gives an overview of your network. So who the contact people are, what they're working on, how many centers are in the network, how long they've been doing it. You can find all that kind of information state by state there via the member network snapshots. There are also two hubs that we want to call your attention to. So a number of you today mentioned that you were starting up new FRCs, and we're so excited to hear that and look forward to welcoming you to our extended family across the country. And there's a resource hub that it was developed with the support of Casey Family Programs and Families Canada, and that is on the website there. And it's a free resource. You just register for it, and then you can access all kinds of information related to the specific phases and steps that go along with those phases for setting up an FRC. And you can find sample materials and tip sheets and other kinds of information all about starting individual FRCs. That's in the FRC Learning Hub. Now, if you're working at the systems level and looking at how to develop a network of FRCs, there's another hub as well that you can find on the website, which has similar information for the steps and stages of developing a network of FRCs, and same thing, tools and handouts and examples from existing networks that could help you save time, not have to reinvent the wheel. The NFSN has a number of webinars each month, like this one you're participating in today, called Webinar Wednesdays, which are free, everyone's favorite price. And to highlight your attention on the next ones that are coming up on September 20th, there'll be one focusing on the Texas Family Support Network, sharing its journey as a newer network, how they've invested in FRCs and what they're doing. And we will also have one coming up in October, although the date actually just changed. It's going to be the last Wednesday of the month, which will be on effective program implementation of the standards. So programs sharing their stories about how they have worked with and implemented the standards that Brenda went over with you earlier. And you can register for these again right from the website. You can also find the Webinar Wednesday library on the website. So that's where there are recordings of many, many, many webinars we've done over the years that cover all kinds of topics related to FRCs, as you see here, FRC networks, standards implementation, parent leadership development, and advancing the field. So for example, you can find webinars that were done by different state networks that have shared their story in the past. You can find Vermont there and Tennessee there, for example. For Family Resource Centers, you can find all kinds of webinar topics about FRCs, like FRCs working with Native American communities, FRCs working with dads, FRCs working with kin and grand families, FRCs working with teen parents, you name it, FRCs are doing it. So we have lots of content to draw from with these various Webinar Wednesdays that are all part of this library that you can access on the website. In terms of services and supports the NFSN provides, one is facilitating connections to our member networks. We're also happy to do presentations like this for key stakeholders. So perhaps you're thinking in your state, you know, we're not green yet on that map, but we'd like to be. Well, if you can find and point us in the direction of the right people to talk with, we'll come talk to them. So whether that's child welfare leaders, children's trust funds, staff, public or private funders, whoever it may be, we're happy to come talk with folks about developing or investing in FRCs and FRC networks. And once again, we do that for everyone's favorite price, free. So there's no harm in calling us, nothing to lose. We also provide technical assistance for developing FRCs networks, and we also provide trainings. And I'll share those with you as I tell you when they're next going to be offered, such as the standard certification training. So the certification training that's offered on the standards that Brenda referenced earlier, more than 15,000 people have successfully completed across the country and in Canada, is offered on a monthly basis by the NFSN, and it is also offered by our member networks. So if you live in a state that has a network or work in a state that has a network, you can find out on the website whether they also are offering the training, which is currently offered virtually, and how you can access that. So you can access it through the NFSN, you can access it through a state network as well. We recently, the training sold out for both October and November. So these are new dates. We had to add on new trainings to support the volume of people who are interested in doing quality work with families, which is very exciting to see. The other training that we offer is about supporting parent leadership development. So Brenda referenced earlier how that is core to the work of FRCs, being grounded in the community, supporting parent leadership development, supporting participants to take responsibility for and ownership of their communities, and be partners in the work of the programs. So the NFSN developed a unique training. You can't find a training like this anywhere. This is focused on supporting staff. So specifically around supporting staff to partner with parents in shared leadership roles through a particular structure, which is called the Parent Advisory Committee. So that training is also offered every month or so by the NFSN, and you can find out information about registering for that again on the website. So here is our contact information on the screen, and once again, the website. And we will now go through the question and answers. We will now go through the questions that people have typed into the question answer section. If you would like to add questions, feel free to keep doing that. We will use our remaining time to answer the questions here. And I will also mention that as this webinar ends, you will see a screen pop up that will ask you a few questions for evaluation. We appreciate your taking a few moments to fill out that evaluation, as it will give us valuable feedback to further enhance these webinars moving forward, understand what other topics you may be interested in. So please take a moment to fill that out. Whenever you exit the training, whenever you exit the webinar, it will immediately pop up. And once again, the recording and the PowerPoint materials shared at this webinar will be posted on the website in the Webinar Wednesday section by this time tomorrow. All right, so for those of you who are still here to address questions that people have shared, someone asked, is the standards training 2 full days? It's 2 partial days, so 2 partial days, so people can perhaps get other work done and then also have the standards training as part of their day. So that's how it's currently offered. Another question that was asked about actions to support federal funding. So the National Family Support Network is a very active member of a coalition of organizations called the National Child Abuse Coalition. And that coalition works on a number of things, including increases in federal funding to support families to be healthy and strong. And part of their advocacy efforts have been around seeking the increase of CAPTA funding, because that funding is already set up and is very flexible. If we could increase it, we know many states will choose to use it for supporting FRCs and FRC networks. So that has been our key strategy to date, is not looking for dedicated federal funding for FRCs, looking for the broader funding for child abuse prevention that we know a lot of states will use for FRCs. Another question that was asked was, what have communities done to get cities and counties to support funding FRC? So first of all, it starts with the education. So raising awareness through presentations like this, through connecting with other states and jurisdictions or cities to learn about what are others doing and how did they do it. And then you could get ideas how to do it. So again, in the Webinar Wednesday library, for example, you'll see so many examples of cities that have set up FRC networks and counties and states. And so how did they do that, right? This isn't something you have to reinvent the wheel for. You can learn how others have done it and get ideas about what may make sense in your context. So we're always happy, as mentioned earlier, to have the conversation with you to think about how you could strategically approach that in your areas. All right, and so the last question that I see here was input on engagement of families that have lived experience. So lived experience is a whole nother story in and of itself. There's a lot of attention to parents with lived experience. Lived experience has often been used recently for referencing families who've had involvement with child welfare. The broader definition of lived experience is to recognize all families have lived experience. The family that goes to FRC and gets the support and never ends up in child welfare also has a kind of lived experience that's very important to pay attention to too. FRCs work with families whether or not they've had involvement in child welfare, as we showed earlier with that continuum, and engagement of families in the parent advisory committees is a key way that families, whatever their experience they may bring to the table, are part of shaping and leading the work of the center moving forward. So thank you for your thoughtful questions today, for your engagement in the buzz session, and we look forward to connecting with you further. Thank you. Again, please remember to fill out the evaluation survey as you exit.